Hundreds of children have ended up in the hospital after coming down with a dangerous mystery virus. 10 states have now contacted the CDC reporting cases of the virus and asking for help. And there are concerns that it could spread to our area. CBS 2's Dr. Max Gomez is here now to tell us what doctors know about this virus. Dr. Max?
Well, Christine, the virus that's spreading through these Midwestern and southern states is called enterovirus 68, or EV68. It's a fairly common type of virus. EV68 means it's number 68 out of more than 100 similar viruses. What's different about EV68 and what has doctors puzzled is the kind of illness that it's causing.
My head started hurting after my lungs started sort of closing up.
EV68 got 13-year-old Will Cornejo critically ill.
White as a ghost, blue lips, he just passed out. Had his eyes rolled back in his head.
Rocky Mountain Hospital for Children has been hit especially hard with EV68 cases.
Our pediatric floor is full of patients with pretty severe respiratory distress.
Cornejo's asthma made him especially vulnerable to the virus. Infectious disease experts say EV68 is unusual because of who's getting sick and the symptoms they're suffering.
Most enteroviruses, they may give you a little bit of a runny nose and a sore throat, but typically don't cause pneumonia. It seems to be affecting kids under 5 years of age more than older kids, and then kids of any age who have asthma.
And while it's not as contagious as other viruses, Dr. Tosi says he wouldn't be surprised at all to see cases show up in the New York area. The good news is that virtually everyone recovers.
No specific treatment, but good supportive care in the hospital usually results in full recovery. There's no vaccine, unfortunately.
Prevention is the same as for the common cold, good old-fashioned hand washing or alcohol-based hand sanitizers. Now, experts emphasize that there's no reason to panic. The virus will probably show up in the tri-state area, but shouldn't be any more serious than a bad cold for most people.
So who should be watching out for this, Doc? And then when do you know it's time to go to the doctor?
Well, that's the important question here. Obviously, any child or adult, for that matter, who has an underlying lung condition, asthma is the most common, should be on the lookout for fever and respiratory symptoms. But anyone who's having trouble breathing should check with their doctor or pediatrician, or if it's serious, go to the emergency room.
You bet.
Trouble breathing is a big deal.
Okay, thanks, Dr. Max.
Thank you, Dr.